Welcome back. Now I want to introduce radiologist Dr. Kent Hudson. He's going to talk about a new imaging surface at Erlanger. Welcome to our program first, Doctor.
Thank you.
What is an imaging? You know exactly what is it? What does it do, imaging surface?
Well, what we have is a new MRI.
Okay.
It's the next generation technology in MRIs. To understand why that's so important, I need to talk a little bit about what an MRI is.
Please do.
And how you take those pictures. So MRI is a picture of the body. Right? It's a great way to look into the brain, the spine, soft tissues, the best way to look at joints. And to take those pictures, we use a big magnet and an FM radio.
Excuse me?
That's right. It's a big magnet, and we put the person in the magnet. It lines up a lot of their protons, a lot of their molecules, and then we send in some FM radio waves. And those FM radio waves are taken up by the tissues and then reflected back to us. And then we use those radio waves to make a picture.
Mm-hmm.
So it's not X-ray, it's not radiation, it's radio waves, just like what we have going around us all the time. Matter of fact, the scanner itself is protected by a cage, a wire cage, to keep out radio waves. Because if we let those in, they would mess up our pictures.
Oh, really?
So
is that about the only thing that could mess it up?
Well,
or several other.
Right. If the just patient motion, if you're moving around inside
you have to be really still.
So you have to be comfortable when you're getting the pictures made, and it takes about 20 to 30 minutes at least to get a good set of MRI pictures. So during that time, you need to be able to hold. So one of the nice things about this new scanner is it's a different design. It's a big donut, and you might, if anyone has ever had an MRI before, you know that it's kind of a tunnel that you go into, and it's kind of a closed-in tunnel.
Yeah.
Well, this new scanner is a bigger donut. It's a bigger tunnel. It's a shorter tunnel, so you don't feel that same kind of claustrophobia that you do with the older style MR scanners. And this scanner, in addition to being bigger, it also can handle more weight. So larger patients can go in there, and because it's bigger on the inside, when you're in it, you don't feel quite so claustrophobic.
So if you weigh 10 pounds or 500 pounds, it will fit? Up
to 550 pounds. It'll take up to 550. So when you're in there, it's roomier, a little easier to handle, and patients can get through the exam a lot more comfort and less motion, better pictures. The other big advantage of this scanner is the new magnet technology allows a high field strength magnet, so a good strong magnet to take good pictures, and it improves the images over previous scanners that we've had that would accommodate large patients.
Does this mean better imaging, which would help the doctors determine that, they know definitely this is right here is the spot, or this is the place, or whatever, versus sometimes having to not guess, but still, it's better.
Well, it's kind of the difference between taking a blurry picture and taking a nice, crisp, clear picture. What we're getting with this scanner is a nice, crisp, clear picture, and we use that for a variety of conditions. Most commonly, stroke, musculoskeletal problems, joint problems, muscle problems, and spine problems, disc herniations. Those are the common things that we'll image.
And Erlanger is the only facility around this part of the country, that's right?
We're the only facility in Tennessee that has this scanner.
Wow. Goodness gracious. By the way, I want you to know this too, that they may do tests on weekends as well. Matter of fact, the hours are 7 a.m. to 8 p.m. On weekends, Sunday hours 8 a.m. to 8 p.m. And you can get all that information on our website. 778-5800 is the phone number as well. Congratulations. Thank you.
Thank you very much.
Now we join Mr. Food in the Kitchen. You know why? Space.